The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. Stop suffering from inflammation and the resulting discomforts. Peak Pain Relief, also known as Peak Relief for our friends in the US, provides a well-rounded approach to help alleviate discomfort and supports a healthy inflammatory response. It also improves mobility and joint flexibility as well as aids in the maintenance of healthy bones and muscles. Get yours today at your local retailer or online at aor.ca or aor.us. Hello, thanks for tuning in to Supplementing Health. I would like to welcome Jason Allen, naturopathic doctor. Jason is one of the founders of Paradigm Health Group here in Calgary. He is an athlete and an outdoorsman, which has led to his passion in sports medicine and pain management. He utilizes this passion in his practice today and will be discussing the ins and outs of common sports injuries. Thanks for joining me, Jason.
Thanks very much, Cassie.
So what are some of the most common injuries that you see in your practice?
That's a great question. I generally see all manners of injuries, but I'd probably say the four most common would be knee injuries, low back injuries, shoulder injuries, and ankle injuries. Knee injuries definitely with repetitive use from running, cycling, patellofemoral syndrome, those kind of things, and then also from knee injuries that come from contact force, like a tackle in football, for example. I see a lot of lower back injuries, chronic pain with flexion and extension. Sometimes when there's discogenic pain, when there's a disc involved, or when there's neuropathic pain from nerve injuries. Shoulder pain, especially the supraspinatus muscle and tendon, the subacromial subdeltoid bursitis, and instability in the shoulder. And then a lot of ankle injuries. There's a lot of ligaments in that lower ankle, the ATFL, which is the anterior talofibular ligament, the posterior talofibular ligament, the calcaneofibular ligament, all these fancy names for ligaments that stabilize your ankle. For example, in trail runners, when they invert their ankle, sometimes they'll sprain those ligaments.
Right. Okay. So sprains are a common injury then that can result from a multitude of sports, not just running, but soccer, or in some people's cases, it can happen just walking along if you roll your ankle or something like that. So what are the telltale signs of a sprain?
Yeah, totally. The classic definition of a sprain is a wrench or a twist in a ligament. Usually it's violent, so as to cause pain and swelling, but not dislocation. If you have a sprain, usually the doctor will grade that sprain. A grade 1 is stretching of that ligament or a very mild tear. There's usually very little or no instability in that joint. A grade 2 is a more serious injury. It's usually still an incomplete tear. There's a little bit of looseness in that joint. And a grade 3 is usually completely torn or ruptured ligament. In medicine, we often think or often quote that a ligament will tear when it's stretched more than 6% of that original length or that normal length. So to answer your question, Cassie, a telltale sign of a sprain would be pain, swelling, bruising, and a limited ability to move that joint.
And so if a sprain is left untreated, are there adverse effects that can be the result other than just looseness in the joint?
Yeah, that's a great question. Let me use an example of a sprained ankle because I think a lot of times when we think about a sprain, we think of an ankle. Statistically, about 80% of sprains in the ankle are in the lower ankle ligaments. So what could happen is if you do sprain the ligaments in the ankle, and we kind of pass that golden rule of 6%, it could turn into a serious instability if it's left untreated. When you leave torn ligaments or stretched ligaments to heal on their own, they can fuse rather haphazardly and form weak and inflexible scar tissue. So because of that, your range of motion might suffer. You might have difficulty walking. And then from there, potentially you could run a higher risk of adverse effects like arthritis or degenerative joint disease in the case of like your ankle. But if it's in another area in your body, it could even be degenerative disc disease. If it's in the spine, it could involve nerve pain and neuralgias too. I think it's also important to say with ankles that we want to rule out fractures because that's one thing that could be overlooked. There's something actually called an Ottawa ankle rule, and it helps to determine if the patient should be offered an X-ray to rule out bone fractures. And then I know I talked a lot about ankles there, but the same thing could happen with sprains in the knee, for example, in some of the collateral ligaments or the cruciate ligaments. It can happen in the spine, say, for example, the neck, the cervical spine with whiplash injuries. It could happen in the SI joint. There's so many joints that have ligaments that stabilize them that can become sprained.
And so if you get a sprain, is wrapping the affected joint or area enough to help it heal properly, or is like other treatments such as physio and things like that required as well?
Yeah, that's a good question. For sure, when it's an acute sprain, I do think wrapping helps because the last thing you want to do is cause further injury to that area. We often think that if the area isn't healed completely and you re-injure it, it'll delay that healing quite a bit. So wrapping protects that joint in the acute setting. But in general, we also don't want to promote wrapping indefinitely because your joint needs that stimulus to get stronger, and a wrapping can sometimes give you that false stability. That means the patient almost has to always wrap in areas of high, injury potential. I think physio is a good an option because a lot of times when you do have a sprain, there are weakness in some of the associated areas, some of the other ligaments or tendons. There could be higher risks for that joint degenerating. So physiotherapy, chiropractic, naturopathic treatments can all help.
And once you've had an injury to a particular joint or ligament on the body, does it then increase its likelihood to be re-injured down the road?
Great question, Cassie. It depends. I think many factors are involved. In some cases, complete healing, if you let the area completely heal, it'll drastically minimize your chance of recurring that injury again or subsequent injuries happening. So that's always the aim, I think, of care. But in some cases, like concussions, Achilles injuries, knee injuries, sometimes if you've suffered that previous injury, it does increase your chance of recurring it again. Uh, a lot of times with ligament sprains and tendon injuries, like I was mentioning, if we don't let that area heal very well, and you re-injure it again before it's healed, it'll take a lot longer to heal it the second time.
And so we've been talking a lot about legs and knees and ankles and whatnot. So another injury that happens a lot when you're doing sports that require running and I guess leg use, if you will, are shin splints. So I guess what causes shin splints?
The definition of shin splints is it's actually technically called medial tibial stress syndrome. And a shin splint is stress on that shin bone or tibia and the connective tissue that occurs in an athlete, especially if there's been recent increased activity, change in training routines, intensity, those kind of things. What causes shin splint? Overloading those leg muscles, the tendons or the shin bone, overuse with too much activity or increase in training. It happens a lot with runners and gymnasts and dancers because it's often an activity that's pretty high impact and repetitive. And we have to make sure that you rule out a stress factor. For running in particular, if I can give a specific example, runners that increase their mileage too quickly can sometimes run higher risk of getting shin splints.
And can splints be healed once you have occurred them?
Yes, yeah. Generally, rest and ice is usually recommended. I'll usually say when an athlete does have shin splints, to avoid overdoing it. I think in specific, for the specific example of running, choose the right shoes. I think a lot of runners, they're running in shoes that are just too old. A lot of manufacturers will recommend changing your shoes even after 500 kilometers. And I'll often recommend runners that are running in consecutive days to rotate shoes to give those shoes a chance to kind of heal between runs. There's been some research out of Harvard, Dr. Dan Lieberman. He's kind of popularized the idea, along with the book Born to Run, to consider zero drop shoes, meaning that your shoes, the padding under your heel and the padding under your forefoot is very similar in stack height, and that might help reduce impact from running. And then I don't think we can forget about strength training, exercise, strength and conditioning to strengthen and stabilize those legs, the ankles, the hips, and the core. Uh, Sometimes we'll also recommend gait analysis just to make sure the runners are the biomechanics of the run look good.
And can cross training help for all sports then?
Yeah, for sure. That's definitely been a new thing lately. Talked about a lot with hockey, right? I think when you do cross train, you stress different areas of your body differently, and that dynamic movement helps prevent injuries. I think for runners, for example, cross training with cycling, cross training with swimming, but even in things like trail running, varying the sports, I think does make you a lot stronger and prevent injury.
Do you find there's specific sports or activities that place people at a higher risk of developing an injury?
In my opinion, all sports can place someone at a high risk of injury. The most common sport right now for injuries is actually basketball. But ice hockey and wrestling we're seeing is the fastest growing sport for women. Repetitive use injuries like running and cycling, if we're talking about specific sports, can expose problems with biomechanics and place that athlete at high risk for developing an injury. But other sports like football or rugby, impact sports, can put higher risks for concussions in those athletes. Or speed-based sports like skiing and mountain biking could put athletes at high risk for trauma. In general, sports, the way I think of it at least, is there's intrinsic risk factors, things like your age, your sex, because there's some data that women, because estrogen may be linked to decreased tensile strengths in those tendons, women may be at certain risks for different injuries during their menstrual cycle, body composition, even fitness level. But then, of course, sports have intrinsic risk factors like human factors, teammates, opponents. Protective equipment's usually involved, like helmets and mouth guards. Sports equipment, for example, the ski bindings will release to prevent knee injuries in falls. Even the environment, there's a lot of risk factors like the weather, is like, for example, in mountaineering, and then a lot of playing surfaces may increase risks for developing an injury, like an ultimate frisbee on grass. There's a lot of knee and Achilles injuries from that playing surface.
Do you find the age at which you started your preferred sport or sports impacts your likelihood of having an injury?
Yeah, that's a good question, Cassie. To tell you the truth, I don't see that in my practice. In some ways, I think of my two kids. I've got a 3.5-year-old daughter and an 11-month-old son. And they're kind of doing a lot more than what my wife and I ever did at our age. And seeing patients in my practice now, I think the ones that started early, in some ways, their competitiveness, their skill levels are a lot higher. They're a lot more progressed. But I'm not seeing particularly more injuries. I'm trying to think if there's any examples off the top of my head. I guess if we look at ballet, for example, a sport where athletes are usually starting very, very young, We do see higher risk of wrist injuries because of the laxity in the ligaments in the wrist. Um, uh, but even with runners, there isn't a lot of strong data saying that with cumulative kilometers run, there's a particular higher risk of injuries in the ligaments or tendons or even in the joint.
Okay, cool. So then, are there changes athletes can make to their training programs to make them less susceptible to injury?
Yeah, that's a good question. Aside from the obvious stuff, I always say do more of these things. Be patient, right? In terms of running or lifting weights. Yeah, be patient, increase your miles slowly, increase your weight slowly. Usually we say the 10% rule per week is a good number. So if you're increasing your mileage as you're training for, say, a marathon, not to increase your weekly mileage by more than 10% per week. Um, Rest, right? I think a lot of us, we're kind of jamming a lot into our day. There's certainly less hours in our day these days. Rest is so important. There was an elite athlete study that was quoted at the last Harvard Sports Medicine course I just did. And they were giving some compelling evidence that only about 3% of athletes can function at a high level with less than 6 hours of sleep. A lot of times when we ask about sleep, a lot of these athletes are getting less than that. And I wonder if that's something that could be easily fixed. And strength training, I think through a qualified physiotherapist or personal trainer, I think that can modify or help a lot of the weaknesses that might predispose us to risks for injuries. And something recently I've been referring a lot to is mobility work and what's called CARS, controlled articular rotations. Trying to get athletes to move in different planes of motion that can help. Gone are the days where I think a strict bench press or a squat will prevent injuries. Now we're doing things at different angles and different speeds and different reps to try to to promote strength in different ways.
And you yourself have some experience as an elite athlete with your Ironman experience and all your mountaineering that you've done. Do you find that when you start to up your level to that kind of elite stature, you need to do more, or do you find it's more about that rest and nourishment at that point?
Thanks, Cassie. That's super kind of you to say. I wouldn't say I'm elite, but for many years I did love to compete in the sport of triathlon. I was honored to represent Canada at the age group World Championships, the Ironman 70.3 World Championships, and the Xterra World Championships. But through that, actually, it gave me a lot of opportunity. So there's a really good sports medicine conference in Kona every year, and Kona is a small island in Hawaii, but hosting one of the largest triathlon events in the world, sometimes over 2,000 athletes. And because there's not a lot of doctors on Kona to actually man the medical tent, they do this amazing sports medicine conference for 5 days. And then we're the doctors in the medical tent for the event itself. I did that for 3 years. Maybe I'll say, what does it mean to be elite? I think in some ways, a lot of our recreational athletes train as much as our elite athletes, and sometimes our elite athletes they actually modify their training to include a lot more rest than our recreational athletes. Maybe the way I think of it, performance and dedicated time might define being an elite athlete, maybe even sponsorship. Uh, in my practice, I think in some ways being an elite athlete actually increases your risk of developing an injury because there's a lot of performance pressures. But in other ways, it could actually increase your risks too, because you have a lot of elite athletes have a better access to professionals, better equipment, better coaching. Um, there was actually a football player's health study done at Harvard, and they looked at rates of injury in the NFL versus quote unquote ordinary black athletes. And for example, they looked at economic disparities in the treatment. I think being an elite athlete sometimes does increase, but can also decrease risks of developing certain injuries.
So, speaking of that performance pressure, what happens if an athlete tries to play through an injury? How can they know how much pain to push through versus when it's time to like call it quits?
Yeah, that's a huge question. And I think in general, we think of progression to play based mostly on patient tolerance. But I have a little bit to say on that personally. I remember the Boston Celtics, the chief medical officer did an interview, and at that time he was saying part of what makes an athlete is the ability to play through pain. And I'll have to disagree with that. I think data showed that at the Rio Olympics, 52% of doctors admitted to giving prophylactic pain relief to their athletes, non-steroidal anti-inflammatory drugs, but also things like injections of ketorolac. There's actually a class action lawsuit happening right now. Think about 2,000 former NFL athletes, and the lawsuits about causing drug addictions, side effects to the kidney and the GI from playing through pain and being medicated through it. We know that retired NFL football players are 4 times more likely to abuse opioids. So my advice, I think never play through a serious injury, like for example, a stress fracture or concussion. You'll never win by that. And a lot of that, they say the male brain isn't really mature until 25. So when we're looking at that subset of the population, especially elite athletes, there's a lot of counseling that we can give them to trust in the professionals. Speak up, be careful for peer pressure. I was talking about a lot about the NFL. They say over 80% of the NFL players would rather get hit in the head than the knee. Um, that's what Rob Gronkowski said. It's kind of an interesting subset where athletes are almost pressured to play through an injury, and I think that could have some detrimental effects.
So is there a time, I guess a time frame or a window of time where an athlete should get treated for an injury? And I'm sure it probably varies a little bit depending on what the type of injury is. But if an athlete doesn't receive proper treatment within that window, does it impact their long-term outcomes?
Yeah, and you're right. I think it does vary according to the treatment. That therapeutic window can vary. For example, if we're talking about something like medication or ice, sometimes you want to get started with that treatment right away. Maybe the first thing is to diagnose that injury. Some will require, like I was saying, immediate attention or a treatment like a concussion, where other injuries like a ligament sprain, for example, when I was talking about the ankle injuries, you can wait a little bit longer. Usually treatment starts when swelling goes down, the patient can walk without pain, maybe about 2 weeks after that injury. Uh, Now, waiting too long isn't good either. If an athlete doesn't receive proper treatment within that window, that therapeutic window, sometimes long-term outcomes could also um, mean more injury. It could mean the injury lasts longer, it heals more poorly, and potentially there's even a higher risk of re-injuring that area.
And so, if an athlete suffers from a chronic condition, such as chronic inflammation or maybe diabetes, something like that, does that impact their treatment and the outcomes after their injury?
Yeah, yes to both. Chronic inflammation, even things like heart disease, rheumatoid arthritis, autoimmune conditions, that excessive and prolonged inflammation does result in delayed healing and maybe even increases scar tissue formation. And for diabetes, because often one of the worries with diabetes is poor circulation or lack of blood flow. It does make it more difficult for the body to deliver growth factors, oxygen, even nutrients to that injury site. So then it does cause more poor healing. We know wound healing diabetics is a lot slower. Sometimes these wounds don't heal at all. So with both, I usually say knowledge is so important for chronic inflammation to make sure that the patient talks to their doctor about blood tests, things like ANA, CRP, homocysteine, ferritin. There's a lot of cool blood tests that can help manage that chronic inflammation. And then for diabetes, of course, a lot of the blood sugars can be tested, hemoglobin A1C, and then there's treatments too, right? I think for chronic inflammation, we know that fish oils, curcumin, they could be very helpful in managing that inflammation. And for diabetes, there's a lot of good research coming out, not only with exercise. We've known for a long time about low glycemic index foods, but there's a lot of research supporting things like intermittent fasting, supplements, magnesium, vanadium, things like that.
So you've mentioned kind of a few of your treatment protocols, or even the testing that helps you kind of determine what your treatment protocols would be. So are there certain types of therapies that you use or find most effective for all athletes, or are they all very much tailored to the specific sport athlete injury that comes up?
Yeah, yeah. In general, I do recommend them for everyone, only because, like I was saying before, some of our recreational curlers and golfers are just as passionate about their sport as Olympic athletes. I learned early in my career that I should never, or I shouldn't really try to differentiate the group in terms of their performance or their medals. So I'm a little bit biased. My practice is mostly in Calgary. My practice is mostly focused around regenerative injection techniques, things like prolotherapy. I recommend platelet-rich plasma a lot. I find them very effective for helping these injuries heal faster, especially in that case with ligaments and tendon injuries, especially in conjunction also with a good chiropractor or physiotherapist. There are therapies that are kind of uh, coming to us when I go to these sports medicine conferences. There's a lot of talk about adipose and bone marrow derived stem cells. That's an emerging treatment therapy that's being researched a lot more, though in Canada that's not performed. Uh, I like using IV therapies, delivering nutrients through intravenous access can help, but we do have to be careful for those treatment plans for elite athletes. And then strength and conditioning, I was mentioning before, I think even diagnostic testing, like you were saying, blood work, just making sure iron and vitamin B12 is checked to make sure we're not missing anything for vegan or plant-based athletes. There's a lot of fancy tests like the NutriEval that looks at all your, it's a full nutritional evaluation of vitamins, minerals, hormones. There's now genetic testing like nutrigenomic testing that can help predict risks based on genetics and nutrition. Yeah, so to answer your question, I do think there's a lot of therapies that are effective, and I think recreational all the way to Olympic athletes can make use of these kind of tools.
That's awesome. It's so cool how much is actually out there and available to people nowadays compared to, I mean, even 10 years ago when it was still very much an emerging field. It's exciting to see the advances that are coming out now in health and wellness.
Yeah, I'm so excited about that. I think a lot of times what spearheads a lot of this is elite and professional sport. But then it does trickle down, it does snowball down into practices like mine, where what I learn at a sports medicine conference or on a pro team means that it helps these weekend warriors a lot. Sometimes especially with sports medicine, I think because performance is so important, athletes will do as much as they can to get that 3% extra in speed or heal that 3% faster. And some of that knowledge then passes down to the golfers that have a knee injury on the weekend or the trail runners training for their first ultra marathon.
Fantastic. Well, this has been a great conversation. I really appreciate you taking the time to chat with me today. If our listeners want to work with you, is your website the best way to get a hold of you?
Yeah, we are working on a new website right now, but www.paradigmhealth.ca is our website. You can book. We have 8 naturopathic doctors, 2 medical doctors, and a nurse practitioner, even a nurse at our clinic. So we have a wide spectrum of people hoping to lend you their expertise for other matters, even that aren't relating to sports injuries or pain management. I'm on Instagram, Dr. Jason Allen, all one word. I tend to update that a little bit more regularly with personal things that I learn. And then you could always phone the clinic or email 403-301-7406 or info@paradigmhealth.ca.
Fantastic. Thank you again so much.
Thank you very much, Cassie. Thanks for having me.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@aor